Hello, everyone. I'm Steve Fisher, your OKA president, and back with you again for another OKA board update. Really excited to share some news and updates. We just wrapped up our November in-person retreat, which was a great opportunity for all of the OKA board to come together and reflect on the progress to date for our annual work plan. It was also a chance for us to reflect on the feedback that you, our members, provided us via our recent membership experience survey. Great opportunity for us to consider and reflect. Before I kind of get into the scorecard piece and the reflection, just want to say a huge shout out to Yvonne, Luke, and Brenda, who all have received a free 2024 OK membership for taking some time to complete the survey. So for those of you that completed this survey, you will know there was a draw for some free memberships. And congratulations to Yvonne, Luke, and Brenda for receiving those memberships next year. But as I mentioned, great opportunity for us to sit, reflect, and consider progress to work plan to not only shape, to not only evaluate how we performed over the year, but also to shape what we do moving forward next year. So with respect to education, again, a fairly ambitious education plan centered around an in-person conference, podcasts, webinars, and overall strengthening and improving Keen. And as you'll know, we did have to pull away on the in-person conference due to a lack of registration. And interestingly, in the membership feedback survey, there wasn't a lot of strong support for moving to physical in-person events. So I do know that we only had about 10% of the membership respond to that survey. So if you're one of those folks that did not respond and you'd be passionate about having opportunities for in-person networking, in-person learning, please let us know, and then we can update our plan. But moving forward, tentatively, we're not considering moving back to in-person events, just given the feedback that we've had so far, unless we hear otherwise from you. So please reach out. With respect to podcasts, launched a 6-episode series, Q2, Q3 of 2023, with some good uptake. We modified the programming for season 2, where we started to look more at kin journeys based on some of your feedback. And again, through the membership experience survey, very positive around the use of podcasts. The one point we do want to consider is making the podcasts available on a wider number of podcasting platforms for those that might be Apple Podcast users or et cetera. So that's something we'll certainly look to in the new year. And then webinars. Had a very ambitious webinar program this year. Really excited. Actually, next week, we have another webinar with Dr. Mike Holmes. So if you haven't registered for that and you're interested in research around shoulder and neck function, certainly check that out. Mike's a really engaging speaker and a Canadian research chair in ergonomics and injury prevention. So he'll have some interesting insights. But again, really ambitious webinar program, and feedback from the membership experience survey was largely supportive. So we hope to continue a strong webinar program in the future, and blending a little bit more of the research and practice. So we want to make sure that those webinars provide some really tangible takeaways for all of our members. On the advocacy side, again, a lot of my messaging in October was really centered around communicating some of the active advocacy we've been doing with the government, and we continue to progress there. We have a number of meetings that have stemmed from that Queen's Park Day, specifically around integrating kinesiologists and having a voice in Ontario's chronic disease prevention strategy moving forward, but also on sort of technical aspects of policy like updating OFC 18 forms to make sure that KINs can sign off accordingly. So lots of work going on that side. And again, as you know, if you've logged into the website, we have a host of resources that we've prepared for you to help engage with your clients in conversations around accessing health spending accounts and other third-party payer benefits. A number of insurance companies do include KIN in their services, like Desjardins, for example. Ontario Medical Association actually includes kinesiology in its plan. I do apologize that the insurance company they're with escapes me at the moment, but there's a number of options. So it's sometimes important to have that dialogue. So check out the OKA website and the member resources. There's lots of resources to help you engage with communities and with your clients to help increase access to third-party payer opportunities. But again, feedback largely positive on the work that we've been doing in advocacy, and we want to continue doing that forward with maybe a thrust around shared advocacy, joint advocacy, and partnerships. So can we have a louder voice if we partner together with some of our healthcare provider colleagues in the space that might have overlapping interests around rehabilitation, chronic disease management, prevention, et cetera, like nurse practitioners, dietitians, et cetera. So really excited. It was a great weekend. Had a lot of opportunity to reflect on areas where I think we've really excelled and areas where we can improve or expand in the future. And as always, we really would encourage feedback from the members. We want to support you. We want to add value to you. So please do reach out and let us know. In terms of some other quick updates, I just want to let everyone know, for those of you that are engaged or purchase home and auto insurance through the affiliation program we have with Johnson Insurance, please be aware that Johnson is now becoming Bel Air Direct. So if you were a Johnson client, that you'll get some messaging soon. You'll be transferring over to Bel Air Direct. And if you're a Bel Air Direct client, you may want to reach out and give a call to Bel Air Direct. You might actually be eligible for a reduced insurance rate now as part of the pooled healthcare provider affiliation that we have through the OKA. So keep an eye out for that. And if you're in the market for home and auto insurance, certainly feel free to reach out to the office or to Bel Air Direct directly and seek a quote there. Also, with November coming, this is a great opportunity for us to introduce new board members. Really excited to see Anna, Nick, Joanna, and Tudor joining the board this year. So we'll be really excited to have them join the team starting in 2024. We also said goodbye to Matt Kohler, Brett Hicks, and AJ Stevens, who have served on the board for quite a while and really had some impactful contributions. Also really excited to say goodbye to the membership as the OKA president, but welcome in Matthew Mendez, who will be taking over as the OKA president in 2024. Matthew currently works as a senior manager of finance for the Guelph Family Health Team, really well connected to what's happening in Ontario's healthcare system, and really well positioned to help lead us and position us within the healthcare system moving forward, particularly as we address the human health resource crisis. So with that, I will wrap up my November update. At this point, we don't forecast a December update, but do look forward to reconnecting with all of you in January after the OKA board meets for our 2024 work plan discussion. And again, between now and then, please reach out to the office, provide feedback, let us know what you like, what you don't like. It will hugely impact how we move forward and how we allocate resources and time and effort in 2024 to help provide value for you, each of our members. So I hope everyone enjoys a safe and happy holiday season. It's been a pleasure serving you over the 2023 year and look forward to continue supporting you as our members under Matthew's leadership in 2024. Thank you.